I thought that I was coming down with a sinus infection. When I said to my husband, I don't feel right. I have like a headache. It feels like a sinus headache and I'm tired. And I just went to bed. The next day and the 2 days after that, I was really exhausted. I was short of breath when I got up to move. I had a very dry cough and I had sinus pressure and I actually lost my sense of smell. 2 days later, I had gone to urgent care. She said to me, you're running a low-grade temperature. And she said that you are a candidate to be tested for COVID. I followed all of the rules that they had given me. And I got the results of the test 4 days later. And I was very shocked because I never would have thought that I would have been positive. How did I get it? Although I was exhausted, I was just sterilizing my home. I was worried about my husband because he has asthma. He ended up getting it. They didn't test him for it, but he had all of my symptoms. So, that was big weight. Again, the fear is there because it's still so unknown. I could not come off of isolation until I had 2 negative tests that were 24 hours apart. So I was, of course, worried because I'm a nurse. I wanted to go back to work. I knew what was out there, and I felt like I was not being productive, just sitting at home when I could be out there helping others. Right before the 2-week period was up, Employee Health cleared me to go back to work. When I went back to work, I've done nothing but take care of COVID patients now. Everything changes day by day. So I feel pride. I feel fear that I'm going to take it home with me again. I have a whole big decontamination process that I do when I leave the hospital. I fear for the patients that are in the bed, whether or not they're going to wake up. And I wave to my grandchildren from a distance. I don't want my grandchildren to live in a world like this. And if I could help to change that, that's what I'll do. Seeing that happen and having somebody wake up and be able to actually say to them, listen, things are moving forward for you, is the inspiration. Just that one patient is the inspiration that keeps, I think, all of us nurses going. And again, it's a combination of wanting to help the ones that are sick and prevent the ones that are not from getting there. It's one big rally for all of us to not only are we trying to get through each day right now, but everybody is rallying to just get through this entire pandemic. And anything that anybody can do for another coworker, friend, anybody, we're just all working in sync together. And it's beautiful to see. As heartbreaking as this is and how fearful I know everyone is for their own safety, their own health, their own families, when you're there, that's it, you're in it 100%.